So, was a normal, healthy 53-year-old woman, had a mammogram in the morning, and by late that afternoon I'd had 2 biopsies. And I think that the radiologist who read my mammogram that day probably literally saved my life, because I had a challenging form of breast cancer. I had HER2 positive breast cancer. I was diagnosed in January of 2006. I was at stage 3A right at diagnosis, so that's closing into stage 4. Mm-hmm. I'd had annual mammograms for a number of years, so I got up, went to my mammogram appointment at 7 a.m. and my life totally changed.
Everyone's story is different. How they react to this information is different. Some people are planners, and they're going to try and figure out, okay, who's the next doc I need to see? What's the next step? What's the most I can do to prevent cancer for myself? And some people, it's a much more emotional reaction. There's no right or wrong reaction, is what I always tell people.
It's such a shock. It's really a surprise. I have no family history of breast cancer. It's like the lightning bolt just happened to strike me. But it's overwhelming. You are scared. But it's as if, pardon the expression, but it's as if someone put you on a tractor beam, because there's so much information that you have to learn in a short period of time and decisions to be made.
Every woman, if you're born with that breast, you're born with a 12% risk for breast cancer. But with some of these gene mutations, that risk can be as high as upwards of 80%. So really high. And there's nothing we can do that can completely eliminate the chance of getting cancer. So a lot of women have some pretty profound reactions to that, especially if they themselves have seen their mother go through something similar. There can be a lot of anxiety wrapped up in this kind of testing, which is very understandable.
My first time that I was diagnosed with breast cancer, I didn't have genetic counseling because I did not have one of the hormone-positive breast cancers. I had a different kind, and that kind typically at that point did not fit a genetic profile that was known. So I did not have genetic testing. The second time I had breast cancer a year ago, I was suggested that I have genetic counseling, partially to find out for my family. I have 3 sisters, and now that we don't have a history of breast cancer in my family, but now that I had had it twice in 2 different kinds, it was suggested that I do go through genetic counseling. It's really interesting.
Well, for example, if someone finds out that they have a new cancer diagnosis, it's very upsetting and life-threatening for them. My experience, though, is that I've seen people come out on the other side and do just fine. So I don't see them as being that this is an end of life topic, but just part of life. So in terms of taking care of people, breast health is based a lot on breast imaging. So that includes mammography, ultrasound, and breast MRI. And these are all tools that we have to see into the breast and see what's going on there. I do breast exams, and I've probably felt a lot more breasts than most people in Seattle. So I know what diseased breasts feel like and what normal breasts feel like. But the imaging is really super important. It's much more accurate than a hand exam or even my hand exam. So imaging is super important, and I help to interpret those tests. I don't do very much in the way of blood work, but it's mostly talking and understanding what the problem is.
I treat almost entirely women who have been diagnosed with breast cancer, and I perform their surgeries, either removing the small piece of tissue surrounding the cancer and the cancer itself, or removing the entire breast, and also taking out lymph nodes underneath the arms if the cancer is spread there.
What ended up with me is that within 10 days I had a mastectomy, and then within 3 weeks I started chemotherapy and also had radiation. So in our family we called it the full meal deal.
So I myself was diagnosed with breast cancer a little over a year ago. I found an abnormal lymph node while I was showering, and pretty much knew at that time what that represented in a woman my age, and that was shortly confirmed with biopsies and with imaging. So I was out of work for about 11 months getting treatment and returned a few months ago. Since I've been back, it's hard to tell exactly how much the experience has had on how I care for patients. I think I certainly now have some insider tips on things that they might be experiencing and stuff that they can do to deal with it, that goes beyond what I learned in school or in my residency.
So I didn't have to take any follow-up drugs. I just had to, after a couple of years of getting this drug and all my treatments, go back to a normal life. So I've had a normal life. I've danced at both of my son's weddings. When you're in the middle of a diagnosis like that and some pretty tough things, I had a life-threatening reaction to one of the chemotherapy drugs and had to stay away from chemotherapy for a few months until I could recover and then go back to it. But those things all give you a bit of a jolt, and they help you see the things that are truly important and how small things don't really matter.